And what we're going to be talking about today is just kind of piggybacking off of what we were doing on Tuesday. So if you weren't here on Tuesday, um, first of all, that review is already available on YouTube. And even if you were here on Tuesday, we can kind of go through some additional examples. But the first thing I'll mention is that when the things that are new for you this semester are what I'm scrolling to right now, which are these flow rate type questions. Um, and what we're doing with flow rates and what's new about it is just this is not the ordered over available type of math that you are used to doing and what you did in 110. You may not have been introduced to flow rates um, yet, although you may have seen a few questions on ATI and obviously from my reviews and these review sets. But the biggest thing is you're calculating for volume over time. Okay. The volume typically used in nursing, or the volume over time typically used in nursing, is milliliters per hour. Alternatively, you could have drops per minute, which is another type of flow rate of different volume over a different type of time. And so on Tuesday, I went over a couple different examples, like for number 19, where I took the 375 milliliters of Ringer's lactate over 3 hours. And then I told you that in order to calculate that, there's really no math involved. It's just reducing. So you are doing some dividing, but you just put the 375 milliliters over the 3 hours. So you have your volume over your time, 375 divided by 3, and then you get a final answer of 125 ml per hour. So if that was, 500 milliliters over 2 hours, or if that was 250 milliliters over 1 hour, like you're going to do the same thing. You're just going to calculate based off of whatever the volume over time is, with the caveat being that if it was volume per minute, like let's say it was milliliters per minute, like in this example here with the Ensure, where they gave you 120 milliliters, 90 minutes, that's your the extra step you have to take is make sure you convert minutes to hours. You're not going to set an infusion pump to ml per minute, okay? You would do it for drops per minute, but if it's asking you to calculate flow rate in ml per hour, then you want to make sure you're calculating ml per hour. Okay. So, like I said, I went through all these practice questions, so I won't bore you with the details of doing that again unless there's a specific one you'd like to see again. I just wanted to kind of highlight the things that are important. Okay. So for this question, right, they tell us that we have 120 milliliters in 90 minutes. So I'm just going to put that volume milliliters over time, and then we want to make sure we convert that time from minutes to hours. So over the different semesters, students have done this a couple different ways. Like most people are familiar with, like, okay, well, 90 minutes is an hour and a half. So they might just take the 120 ml and divide it by 1.5 hours, and then you still get the same answer, 80 milliliters per hour. You just got to remember to do the to reduce the fraction, and then also remember, or if you don't like doing or dealing with decimals, then this is the alternative way, is just converting minutes to hours, which is good practice anyways, because you probably need to know how to do some of that anyhow. Um, the the next kind of set of questions dealing with flow rate is what's called drop rate. And when we calculate drop rate, we need two pieces of information. We need the flow rate, the volume over time, and we need a drop factor. Now, the flow rate is either going to be given to you in ml per hour, or it might be given to you in ml per minute. Like in this example, they tell you 75 milliliters in 25 minutes. Okay, so they give you that flow rate. Um, and when you are practicing these things, you will see like they'll ask you like, okay, well, what is the flow rate in drops per minute? That's your clue that if it's already in minutes, leave it alone. Okay. If you're starting already in minutes, there's no reason for you to then convert it back into minutes again or convert it to hours and then back to minutes. You're just doing extra work that you don't need to do. So 10 minutes, leave it alone. And that's what I did here, right? So we had 75 milliliters, 25 minutes. Then I just multiplied by the drop factor. Drop factor was listed on the label. It said 15 drops per ml. The way we abbreviate drops is GTT. And then we just multiply across the top, divide by the bottom, and I get 45 drops per minute. If this had said 75 ml in, 1 hour, then yeah, you would want to convert the hour to minutes and then solve for your drops. Now, I did a question like that. When we come down here, I did this one here with the where it tells us we have 1,440 cc's, okay, which is the same thing as mLs, and then it says 12 hours. So this one had where you had to convert hours to minutes. And so what we did was I gave you a couple scenarios, but the way that when I originally came up with this question, I just in my head said, okay, well, let's just reduce this. And does 12 go into 1440 evenly? It does. So 1440 divided by 12 is actually 120 ml per hour. And so once you're there, once you can get it down to per hour, you already know that 1 hour is 60 minutes. So 120 ml per hour is the same thing as saying 120 ml per 60 minutes. And then you just convert your ml per minute to drops per minute via the drop factor. And like I said, the drop factor is always going to be given to you. So it'll either be given to you as a text or it'll be given to you as an image, like a picture of a label, as you're seeing here. Okay. So those are the big, like newer type questions. The rest is just very similar to what you had on 110. So if there's any questions you missed on the 110 test, that you're like, oh man, I can't believe I missed that. Just make sure you review those types of questions. Make sure you're, feel pretty good about your flow rate, or not your flow rate, your rounding, um, availability and how to do the rounding, when to round, when not to round, um, practicing your fluid replacement volume type question. And I have an example of that in this packet as well. And just practice those questions. The only other question that was like a little bit more like they consider like a two-step type question were these like 22 and 23, where you're going to take you have to account for the patient's weight. So you're going to take the patient's weight in pounds, convert it to kilograms, and then solve for either like in this first question, the number 22, you're just solving for what would you give them in their loading dose. So you don't care about how much per day. You don't care about converting it to milliliters or tablets or capsules. You just care about doing that two-step process of going from pounds to kilograms and then going from kilograms to milligrams. The only other thing you might get is, let's say they told you that Dilantin was available 250 milligrams per 5 ml. Then you might want to, the follow-up question is how many mLs would you administer for the loading dose? And so you would just take the 1200 milligrams over 250 times 5, and then that would give you your loading dose in ml. And I have to say, I think this is really high from what would probably make the most sense for this type of medication. So just remember that just because the number seems wrong doesn't necessarily mean it's accurate as far as from a clinical standpoint. It's just more about, can you do the math? Number 23 is also considered what we would call a two-step, kind of more challenging problem. And it's because you have to do an extra step of converting. Okay. So in this example, you're ordered 500 micrograms, but your available is in milligrams. So you either need to convert micrograms to milligrams, which is what I did, or you need to convert milligrams to micrograms, which is the alternative way to answer this question. Okay. All right. So, um, the key, I'm pretty sure, is fairly accurate. So just you can double check if there's anything that seems wrong or you're getting the wrong answer when you work through this. Just let me know and I'll make sure you have the correct answer. But what I'm going to do is, I'm going to leave it open. If you have any specific questions or any side questions or any questions on what might be on the test, let me know. And like I said, you can unmute and just talk, or you can type it into the chat like you want to see number, whatever, or you want to see a type of question or another example of, just let me know. Okay, good. So some good questions about rounding. Okay. So the first question is, when converting from pounds to kilograms, do we follow the same rounding rules? So the rounding rules for nursing are always going to be um, that you want to make sure you're rounding to the nearest tenth. So that is still the correct thing to do. I know the examples that they give within the blueprint is just like is basically just based off of mLs. And that's because you are going to see some things like you might get a syringe that you can measure down to the hundredth place. That's what they show you, this like 0.96 ml or 0.75 ml or 0.25 ml. So you do have syringes. You actually have syringes that can measure down even to the thousandths place. So you could actually measure out 0.125, mLs in a particular, if you have the right syringe to do so. But they don't typically address that in the context of what we're seeing here um, in these dosage calc type questions. But whenever we're transferring or going between different units of measure, meaning when we go to the metric system to the household system or the household to metric, those numbers don't are not necessarily always even. Okay. So when you are converting a patient's weight in pounds to kilograms, when you get your answer for that, yes, you do want to round to the nearest tenth. And that does include when you're solving for something like, and I'm just going to go back down here to, I should have stayed down here, to that question, the Dilantin question, where it says, um, 176 pounds, right? Now, let's say that was not an even number. Let's say it was 100 and let's just say 107. Yeah, let's just try 173 pounds. Of course, that might work too. So what I'm going to do is in my calculator, I'm going to take 173 divided by 2.2. And what I'm going to get is 78.636363 repeating. Okay. So when we're calculating a weight-based calculation like this, you want to use 78.6. So you do want to round it to the nearest tenth. You do not want to round up to the nearest whole number when you are working with kilograms. Saying that, if you're told otherwise by your instructor, then you follow whatever rules they give you. But based off of the blueprint, those are the rules that I understand as far as rounding is concerned. Okay. Um, yeah. So the rounding rules are the same for all 4 semesters. When you have a number greater than one, round to the nearest tenth. When you have a number less than one, round to the nearest hundredth. Okay. The only caveat to rounding that's different this semester is when you deal with drops, right? So if you have a drop rate question, and you get an answer like 20.25 drops per minute, you cannot administer a partial drop. Just like you can't administer a partial capsule, right? You probably remember hearing that in 110. Like you can't give someone a partial capsule. You can't even give them a half a capsule. Half a tablet, yes, but half a capsule, you can't do that. Okay. Or at least you're not supposed to do that. Um, so you have to give them the nearest whole drop when it comes to rounding drops. So if it's like 21.25, then you're going to give them 21 drops per minute. If it was 21.75, then you're going to give them 22 drops per minute. So great questions on rounding.
Dr. Ed, I just had one other question with the rounding. Like,
Yeah.
what if it was 178 pounds, which that comes to like 80.90 repeating?
Mhm.
Would that then round to 81 and it would be a whole number?
Nope, just keep it at 80.9.
Oh, really? Okay.
Mhm. Yeah. So the only because the what determines rounding up to the whole number would be the number next to the tenths place. So you look in the hundredths place. So since it's 80.90,
Okay.
then you would just leave it at 80.9.
Okay.
In reality, like from a clinical standpoint, yeah, you probably are going to just round it to 90 and just work with that because
Okay.
the difference between 1/10 of a kilogram in your final calculations is going to be minimal. But to stay consistent, like when they write the keys, or at least when I've written these tests and I wrote the keys, I always base it off of those rules that I've given. Now, I haven't written these tests in a long time, so they're using different tests. They're all same based off of the same criteria, but my understanding is that they're still using that, or they make it so that it's a whole number, like I use the 176 pounds. That way you don't have to worry about rounding that, especially with those types of questions, because you will get different answers if someone thinks that they're supposed to do, like you just said, round it to 90 versus leaving it at 89.9. My
Okay.
recommendation would be to leave it at 89.9.
Okay. Thank you.
You're welcome. Yeah, and if there's ever a discrepancy or something like that, you can always like, you know, you can always say like where you learned that from. You can CC me on, an email to your instructor if there's anything. But I'm gonna be honest with you, I have yet seen that as an issue. Usually, when students miss these weight-based problems, is because they multiplied by 2.2 instead of dividing by 2.2, and it's just a math error as opposed to a rounding error. So,
Hi, I have a question. So for the dosage calc test, say for example, for number 22,
mhm.
so we found the first part, which was the kilograms to pounds, and then we multiplied that answer by the 15 mg. Is it going to ask for the 300 milligrams part? Do we have to solve that for the
So good question. So when you look at the question, right, it says, and I even highlighted it, for the loading dose. So that's all they're asking for.
okay,
Now, if they wanted to know the maintenance dose, you don't even need to do anything with the patient's weight. It's just 300 milligrams. That's why I don't think that they're going to ask you anything about the maintenance dose. They're just going
okay.
to ask you to calculate the loading dose.
Got it. And the loading dose is the 15 mg of a kg loading dose. Got it. All right.
Yeah. And I will say the only other thing they might do is there's a Dilantin label up here. Let me just find it real quick. So let's say they took this label of Dilantin, right? And let's say they applied it to what you got. So you got 1,200 milligrams in that particular example. They might say, how many mLs would you administer um, once you have the milligram dosage? Okay. So that might be the only thing that might be different.
Okay.
And then you would just do what you hopefully already know how to do, right? You know how to take the milligrams, the order over the available, and then times the quantity, and then you're answering that question just fine. And then obviously anytime you see Dilantin, just make sure, are they asking for teaspoons or are they asking for ml?
Got it.
Yeah, thank you for all your questions. Is All right, so yeah, just go through. If you see any questions that you have, just let me know. I'll be here. I'll just be on mute. If you have any questions, just like unmute or type it into the chat. If you don't have any questions, you just want to practice some more. That's perfectly fine. Don't feel like you need to stick around. But I'm here if you need anything. Okay.